Welcome back to DLC, our 4th birthday party. We've been celebrating all day with live demonstrations, question, answer, and it's been so much fun. We have been going through all of our exciting raffles. We've been hearing from our patient community all day, and it's making it so much fun. It really feels like our birthday. And so what we're going to do now, starting now at 3 o'clock, our next session right now, is I'm going to be talking about, of course, our fantastic ISDIN products, and I have Emily Jenkins here, who is our ISDIN product expert. But I want to give you a little bit of a roadmap of what's to come. This is a very exciting hour. We're also going to be demoing live laser hair removal on pigmented skin, and so that you can see that we have wavelengths that are safe for all skin types here at DLC. Not only are they safe, but they are effective. We have the most powerful device on the market for laser hair removal for all skin types. You're going to get to see that live. We get lots of questions about laser hair removal. Am I a candidate or am I not a candidate? When am I a candidate? Is this area, a candidate area? So we're going to be able to get your questions answered, and you can see what laser hair removal is like live. This is exciting because we can't typically demo a live laser hair removal treatment during a live event, but we can during a virtual event. Then we're also going to be doing some chin augmentation. I'm going to be doing chin augmentation on one of our fantastic clinic team members, Andrea. And we're going to shift gears, and we're going to also demonstrate using our Genius device, which is radio frequency skin tightening that's also radio frequency microneedling for hyperhidrosis. So one of our team members doesn't want to sweat in their underarms anymore, and you're going to get to see that live. Then we're going to shift over to the Halo room, and you're going to get to see a Halo demonstration as well as PRP, or platelet-rich plasma. So start compiling your questions if you have them now. It's going to be a really fun hour. But right now, I'm going to go right back to the ISDIN products. These are some of our favorite products here at DLC, and they really fill some important gaps in both skin rejuvenation as well as skin maintenance, as well as the skin of our feet and the nails. So I'm going to start off with talking about 2 of their sunscreens, because there is a component of the ISDIN sunscreens that is not present in any other sunscreen, and it's called photolyase, which is a DNA repair enzyme. So for patients with known sun damage, or they actually have precancerous change or made a lot of skin cancers, it's really pretty unequivocal that we will recommend the ISDIN Irrifotona sunscreens for them. There's one that's tinted and very cosmetically elegant with anti-aging peptides, as well as another sunscreen, which is the Irrifotona Untinted, that is really kind of a favorite among our men with a lot of UV damage and maybe known precancerous change or have a history of skin cancers. So can we loop in Emily to see if she has anything else to add on some of these particular products? So welcome, Emily. Thank you so much for joining us. Anything else you want to say about the Irrifotona incredible I hate to call them sunscreens because they're really therapeutic treatments that have the additional benefit of being a sunscreen.
Absolutely. Thank you for having me. These products are truly unique in the sense that they have the ability to repair past damage, as you mentioned, and to prevent future damage. Actually, a Nobel Prize winning ingredient with photolyase in those, and the cosmetically elegant component to it makes it easily spreadable and able to use every day.
That's right. I think that's a really important component. Like, both of these products are very cosmetically elegant in that you cannot see them, you cannot smell them, and you cannot feel them once they are on. So they are truly favorites among our patients, whether they're really active patients and they don't want to feel it on their hands. It's really comfortable to wear every day. And the next product I want to highlight, and Emily's probably going to laugh because this is one of my favorites, is Melanotonic. Melanotonic has 3 really important anti-aging benefits. It has melatonin, which is essentially an enzyme antioxidant booster. So it boosts antioxidants that are already present in our skin, as well as adds other antioxidant powerhouses within it. And then there's also something called bakuchiol. Bakuchiol, it mimics many of the retinol receptors. And so it has many of those retinoid benefits, but it's much, much gentler. So for our patients with the most sensitive skin that really have a hard time tolerating anti-aging products, then I know the Melanotonic can work for them. It's also very much improves redness and pigmentation. So patients that are very sensitive and then also have these problems, and I know I have an anti-aging product that will work for them. And finally, of course, it has potent vitamin C, which is another antioxidant, but in a formulation that is gentle, because vitamin C can sometimes be irritating. Chaos is the eye formulation from ISDIN that we really love here at DLC. It really helps with the hypervascularity and the pigmentation under the eyes. Anything more you want to add about the Chaos, Emily?
Yes, actually, Chaos is a great product that can be used AM or PM or just at the night, and it reduces the dark circles, puffiness, adds hydration. Just an overall great product, and for sure a DLC favorite.
Definitely a DLC favorite. For people that have a tendency to pigment under the eyes, which oftentimes can be genetic, it's really challenging to find either a product or even a procedure that can help with that periorbital pigmentation. And you'll see, if you do have that tendency, or if it runs in your family, you'll see that it worsens over time. So treating it before it really becomes in its more advanced stage really can be vital. And so treating it when you're young, just as you start to see that pigmentation happening, or if you know there's a strong family history, I recommend people starting it sooner. It's very delicate skin around the eyes. There's only certain procedures that are safe to do in that area. And so having a good topical home regimen is a really key component to a great outcome. The next product I want to talk about is the Podos. Emily knows that I love this product too. This is a really great product for dry or thickened, calloused feet. It will soften the feet up, and it's really, really nice in the sense that it's fragrance-free, it has a gel-like consistency, it has also a really neat applicator, so you can more or less kind of squirt it around your toes and onto your feet. Anything more you want to add about the Podos as well, Emily?
So this is a great product for sure.
Yeah.
Men, women, all ages, and the 10% urea in it will help with the skin roughness, but then the hydration component as well.
Exactly, because that's a hydrating acid that also dissolves that thickened, scaly skin. It's just going to dissolve it, as well as carry moisture right into the skin. We talked about these hydrating acids earlier today, because a lot of times it's puzzling to people, like, wait, an acid is hydrating? And it's like, actually it is. That free hydrogen, you can tell I was a chemistry major, that free hydrogen, it's going to pull more water into the skin and carry it safely through the skin, so it will hydrate and at the same time dissolve that rough scale. So Podos is a really fun gift too for people that like to take care of themselves, take care of their feet. It pairs nicely with one of the treatments we have here at DLC called Baby Foot, that is a very, 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 very descaling, will really dissolve those calluses, but then you want to maintain it, and this is our favorite for that. Next I want to talk about is a nail product. If you know much about me, my academic area of expertise in medical dermatology is nails. And SI Nail, SI stands for silicone, is a great product for really restoring nails that might already be damaged from long-wearing manicures such as gels or dips, or acrylics, even traditional acrylics. Once those nails come off, you're really going to have to rehabilitate the nails that you have, and that the silicone helps form a nice barrier on the nail. So it's also great for people with just really weak nails to begin with. I don't recommend oral biotin because oral biotin is not risk-free and does not have strong data to help our nails. So different products such as the SI nail are really a key component to rehabilitating your nails. I probably said a lot about that one, Emily, because I talk a lot about nails, but anything else you want to add?
Just one other thing is that it can be used as a treatment, and then also just to maintain healthy nails with all the hand washing right now. It's a great product to put by your bed at night to use for hydration and just to keep your cuticles healthy.
Yes, absolutely. And I'll probably circle back to melanotonic, but I first want to touch on the sunscreen brush from ISDIN. So ISDIN also has a sunscreen brush. We have two brushes here. What makes the ISDIN brush unique is that it does not have any shimmer at all. So if you have the most sunscreen-averse family member or sunscreen-averse athlete or golfer and your family, trust me, they can use the sunscreen brush. You do not feel anything, you don't know it's there, and it's water resistant. And there's no no cosmetic type quality to it, so it's very male friendly, if you will. Anything else you want to say, Emily?
This product is a great on the go, so you can put it in your pocketbook or your golf bag. You can use it in your hairline or your ears.
Yeah, that's right, on your parts and your hair. Exactly, that's a really good point. Especially, not everyone loves wearing a hat. You know, I'm a dermatologist. I wish everyone would wear a hat, but I'm also a realistic dermatologist. I want to be a good partner with my patients. So if they're not going to wear a hat, then they have to have another option for them. And the sunscreen brush can go very easily onto a scalp and other hair-bearing areas. And of course, you know I love anything that I can leave in my car. And this is heat stable, and you can leave it in your car, and it's a great opportunity to reapply that way. So we're going to move it on over to the Splendor X, which is our device here for laser hair removal. We're going to send it on over to Leanne, and you get to see live laser hair removal with the Splendor X.
Hello, it's Sandy again. We are here with Lydia, and we're going to demonstrate laser hair removal of the lower legs. Now, this is the Splendor X, like Dr. Ivan mentioned, which is actually two kinds of lasers in one. If you're familiar with lasers, Alexandrite technology as well as YAG technology. And so I'm going to demonstrate Lydia's laser hair removal of her lower legs. Now, prior to this appointment, she has shaved her legs yesterday. You want the hair to be as short as possible, because if there's a lot of hair on top of the skin, the energy will go sucked up into the hair and not get to the bulb of the hair, which is where the growing part is, which is what we want. So she has no visible hair on her legs right now, thank you, Lydia, and we did cleanse and prep her skin. Now, I've got my settings all ready, so we're going to do a couple of passes on her lower legs just to show you how quick and pain-free this treatment is. If you'll close the door, please, Lindsay. All right, are we ready? As a safety feature, it does have a double start mechanism, so it just takes a minute. It'll get loud in here too. Okay, Lydia. Enter your leg. What's your pain level, Lydia? Turn it off. Awesome. All right, and turn your leg out. All right, let's move on to the top of the next leg. And turn this leg out, please. Now, this laser has a built-in cooling device, and so it actually cools the skin, making the treatment much more comfortable. All right, we've got the front of Lydia's leg, so let's put the machine in standby. One thing that's really important with laser safety is making sure that everyone is wearing appropriate eye protection. So Lydia wears these metal goggles during the treatment. I and Lindsay, we both have on these laser light blocking goggles, because safety is always our goal here at TLC. And you can see, gosh, it just took me maybe 2 or 3 minutes to do the entire top of her legs. And so we'll have her turn over and do the back of her legs in just a second. But how was your pain level during the entire experience?
0 out of 10.
0 out of 10 pain, and this is her first time ever getting this treatment. She has never had and family of fillers. How exciting. See you there, Dr. Adamus.
Hi, welcome back, guys. Yes, we are here with one of our awesome clinic team members, Andrea, and we're going to be working on Andrea's chin today. So an important part of the kind of cosmetic aesthetic and the human face is the chin. It's really critical for the appropriate balance in the face. Imagine you have, a certain proportion for your upper face, certain proportion for the nose and mid face, and then if your chin kind of shrinks down and you don't have the right proportions. And so it's really important for proper balance in the face, as well as contour in the face, and for balance. So balance, contour, and profile. It's also, as we age, the chin changes. In fact, our whole face changes, but it's pretty pronounced with the chin because the mandible is one of the larger bones in the face. And as the mandibular bone starts to resorb, absorbs over time, it can cause a woman's face to become very square or very round, and for the chin to push back. And so it can be a little bit masculinizing. And for a man, the chin and the jaw will actually become more narrow, which can become feminizing. And so restoring those areas of the face for both men and women is a really critical part of the overall aesthetic. And when I'm assessing someone and assessing kind of where their areas of volume loss are, it's very common for the chin to play a really important role in that assessment. And so I've actually done a little bit of filler in Andrea's chin, but it's been a long, long time. And Andrea's chin does go posterior to her lip and her nose. And so this area of her face really ideally lines up. And over time, again, her chin has started to resorb. And so I need to improve her chin projection as well as define her jawline, really to kind of restore where she's had the most volume loss. Again, this is not to make Andrea look like anyone other than Andrea. It's really targeting these areas where she's had bone loss. One of my favorite products to use in the chin is a Juvederm product known as Juvederm Voluma. Juvederm Voluma is a sturdier filler, has very long-lasting effects, which is also very nice. It's our longest-lasting filler. In studies that shows to last up to 18 to 24 months. And in this area of the chin, which is not a mobile part of the face, using a filler with some heft really duplicates the anatomy in that area. Your chin typically does not move all that much, and I'm really using this to build up the bony prominences in these areas. All right, so you guys ready to get ready? And if any questions, feel free to ask questions during this, and I will, answer your questions as we go along. So again, I'm using Juvederm Voluma. There's different ways, when I say ways, different techniques on how to approach this. And sometimes I will use something called a cannula, which is a tube. And sometimes when I really need to build an entire jawline, using that cannula will allow me to thread all the way along a jawline to give a perfectly straight line. That's not what Andrea needs. She needs anterior projection, so I will be using the needle with her. And she's been using numb gel. She's had numb gel on for about 20 minutes. And that really helps with the initial needle stick. Now keep in mind, there's also lidocaine, which is an anesthetic in the actual filler itself too. So I'm gonna first address these areas where we want her to have appropriate chin projection. To build up where she's had volume loss. Doing okay, Andrea?
Yep.
And you'll feel me kind of mold it a bit. Just a moment. Perfect. Okay. Yeah. So this is the top projection, and all of these spaces on the chin have a name. And we know when you study kind of the appropriate contour of the chin, nice right there while I talk to her, then we know which area we need to build to give a nice appropriate contour for her anatomy. her impress here. A lot of patients ask me, what are you doing? I'm like, I'm molding the filler where it should be. So here's a question. What ages typically need this treatment? This is actually a treatment that I do on all ages. Could you go ahead and isolate that? I'm just taking it out. Because it depends on sometimes when I'm doing restoration or rejuvenation, when someone has had bone loss and chin loss over time as part of the aging process, obviously that patient is going to be of more advanced age. Sometimes this is genetic. Sometimes patients come to me for correction for this at a younger age, and sometimes they see me and they may see a plastic surgeon if they're considering a chin implant, which is a surgical correction that sometimes needs to be augmented over time, again, because that chin changes over time. This is a non-surgical alternative to chin augmentation and has really become more popular if you kind of study trends in plastic surgery and dermatology. Has been more popular than the chin implant just due to its really superior safety profile. So for people that have a hypoplastic chin or want to improve the overall contour of their jawline and their chin, I may see them at a much younger age. I'm just getting a new needle here. I'm coming. All right. Perfect. So already she's having more chin projection. And what I'm doing is essentially redefining her chin. And I oftentimes will do this over the course of more than one session. Allow this initial syringe of filler to essentially settle into the tissue and then bring patients back and add more. Now you can imagine for a man, he's going to need the anterior chin and it's going to be broader, right? A square jawline and a square chin is more masculine. For a woman, it is the narrower face, extended jawline, but narrow to a slimmer chin. So different technique, different approach, whether we're dealing with a woman or a man. I'm already very happy with the way her chin looks right now. I think that Andrew will be too. I think a key component of all of this, of course, is treating the entire mandible. So our mandible is resorbed over time too, so you lose that jawline. Oh, here's a question. Is there post-filler bruising or soreness? And the answer is it's very common, right? Because we are actually, I'm placing filler in this area, and right now it's numb. But then when the numbness wears off, you can be sore. Now, typically, it only hurts if you touch it or try to, press it firmly. But that goes away within just a few days. And whenever there's a needle involved, a bruise is a possibility. We do laser all of our bruises here at DLC. So if you have a bruise, we will treat it. Okay. Here's another question. Is there anything I should do before or after filler to avoid bruising? That's a great question. So if you are concerned about bruising, there are several actions that you can take. We do ask that you stop any potential blood thinning agents such as NSAIDs like ibuprofen or aspirin or naproxen, or fish oils or supplements that can cause you to bleed. And then we also do an oral supplement called Arnica, an oral Arnica supplement. We carry the Silogen supplements here, and you can start those a couple of days before your appointment if you are concerned about bruising. Okay, so now I'm going to extend her mandible here. Because again, it starts to resorb and move forward and causes an anterior kind of jowl. And so this elongates the mandible and basically puts it back where it's supposed to be. Okay. Moving right along. I'm actually going to come to the other side, Diana, so we can switch. Molding it all the way up. And already you can see that some of these little wrinkles that were forming around your chin are starting to disappear. Okay, so I'm going to work on this side now. Again, I'm coming all the way posterior to your mandible to reconnect it. I use other products in kind of redefining the jaw. Sometimes I use Sculptra in this area, but for the chin, I prefer the hyaluronic acid fillers. So the Juvederm products are typically my favorite on the chin. There we go. Nice, beautiful, long jawline. How do you feel, Andrea?
Fine.
She feels fine. Okay, good.
You can kind of hear it.
Yeah, you can kind of hear it going. That's right. Okay, it's nice and smooth. I don't see any bruises right now. If you turn to the side, you can now see that her jawline extends all the way back to here. I restored this area with Voluma in the anterior chin so that she has a more contoured and substantial but still delicate and feminine jawline. Oh, how do you choose what filler you are going to use? Good question. So it has to do with the properties of the filler. And what I mean by that is if we're going to be in a very mobile area, then I need a very elastic filler. If we're going to be in an area that's immobile, that property is less important. Instead, I want something that's going to have strength and heft to be able to support tissue. In this particular area, I'm building up an actual bone, so I need a filler that's going to lay down on that bone and stay there. And then I'm extending her mandible posteriorly, so I want something that's going to stay right along that mandible. Sometimes women really become very bulky in this area, especially if you grind your teeth at night, and the muscle can become very, very large and bulky. It's kind of like a bicep right there on the side of your face, and it can make your face contour appear very square. And so if I'm, again, assessing someone and I want to improve their chin contour, sometimes I need to treat that muscle as well. And that we treat with Botox or Dysport or Jeuveau. And then that will restore a slimmer appearance to the face, a slimmer contour to the face. And people like that they don't grind their teeth at night too. That's another kind of added benefit. But typically I'm doing it to restore that slim, feminine contour to the lower face that leads to a slim but substantial chin and a complete mandible. Okay, there was another question that came in. What is the difference between this and Sculptra for the chin and mandible? Oh, this is such a good question. Okay, so when I'm using Sculptra, I'm really rebuilding the entire lateral face. And Sculptra is fantastic. And if you know me, you know that I love Sculptra because it builds your own collagen. It is a biostimulatory filler. Hyaluronic acid fillers will fill a space and the effects are immediate. In this kind of midline area, rather than the lateral chin area, but midline area, the hyaluronic acids tend to give the better result, more predictive result, and a really nice outcome. So time to move on. So we're going over to Carly Wagner, our nurse practitioner here. So you get to see some genius for the unwanted sweating in the underarms, and this is a permanent treatment for that particular unwanted sweating.
Thanks, Dr. Adigan. I'm here again with the Genius RF. This time we're using it for hyperhidrosis. I've already started with Lydia. This is her second treatment. She's had her first treatment about a month or two ago. She had about 30 to 40% reduction in sweat with that first treatment, but wanted to see a little more. So we're going to do her second treatment. So far I've done 3 passes on this first arm, and we're going to do a couple more, and then we're going to move over to the other side.
Okay, I'm super tall, so I'm going to sit down. So yes, this, again, if you were able to see us using the Genius earlier today, we did a full face of the Genius for skin tightening and collagen building. But now we can use this same device with, of course, completely different settings in the underarm for permanent reduction of sweating. The sweat glands are really very highly concentrated in the underarm, and they sit in a superficial subcutaneous fat layer right here in the XL, as I'm like demonstrating on my own body, which means that we can actually reach them with this device. The needles go safely into the skin. Remember, they're wrapped in that thermal sheath. They leave the thermal sheath, and then we decide just how much energy we want them to release. And that energy, in turn, actually destroys the sweat glands permanently. So with each treatment, we won't get every single gland, but you get about a 25 to 30% reduction, permanent reduction in sweating with each treatment. So again, when people ask, how many treatments will I need for this particular procedure, I tell them to start with one treatment and see how they like it, because a lot of times a 30% reduction in sweating is a lot. I think that you had a patient that had 50%.
Yes.
Yeah, so you may have one treatment and maybe 50% reduction in sweating. And so that is dramatic. And so you may only need one treatment. When we're using Genius for skin tightening, it takes multiple sessions to really get the best outcome. But for this, our endpoint is different. Our endpoint is reduction in sweating. How are you doing, Lydia?
I'm good.
Lydia's doing good. She's comfortable. Now, you did some injectable lidocaine here, right?
Yes, we did.
So she doesn't need any kind of pain management. There's no numbing time. There's no Pronox, no oral sedation, nothing. Because in the underarms, we can actually just inject lidocaine, and then she actually feels nothing. How are you doing?
Good.
Okay, great. So do we have any questions for the Genius? Oh, looks like we do. Is this only for the underarms? What about forehead sweating? Oh my gosh, this is a great question. So we don't recommend this for forehead sweating. If we needed to reach the sweat glands in the forehead in a very significant way to permanently reduce them, there's a lot of other very important structures in that area. We do use the Genius on the forehead, but at a completely different depth and energy level, because that is for rejuvenation purposes. But the good thing is that we have another option that is a very predictable and very effective way to manage forehead sweating, and that is with injectable Botox. When we use Botox for wrinkle reduction, it typically lasts about 3 months, sometimes up to 4 months. But for sweating reduction, it lasts longer. It lasts about 6 months. So sometimes it's really common for me to treat foreheads or entire scalps of men that are bald or wear their hair very low and they don't like the beads of sweat showing on the top of their scalp. So I easily treat that with Botox. It also has the added benefit of oil reduction as well. So if you have a very shiny, oily forehead and scalp, Botox can work very well for that. But this, we really do the permanent sweat reduction, which is the permanent destruction of those sweat glands, or the eccrine coils, which is the medical term for them, in the underarm. There's surgeries for this that are not risk-free. So it's really kind of, oh, am I in the way? Okay. And so it's nice to have a non-surgical option that will treat this. This can be a nuisance, and it's very distressing. In medicine, we call it hyperhidrosis. If you really sweat excessively, antiperspirants are not sufficient. To have a permanent, totally effective treatment that's also safe is really fantastic. And you can see it is a centimeter square applicator tip on the Genius, and each one of those centimeter squares is 49 tiny needles, and each one of those needles has a little sheath on it, so it can go into the skin, release heat energy, and come out of the skin without distributing any heat to the skin surface. So it's safe on all skin types. It won't cause pigmentation or loss of pigmentation because of that added safety feature. It is unique to this device, which is really a nice characteristic. Any other questions? Is there any recovery period? There's really no extensive recovery period for this particular treatment. You can sometimes have redness in the underarms that lasts several days. This is a great question. Can it be used? Yes, okay. So I just got another question that said, can this be used in the groin area? The groin is another area that can have excessive sweating that can be very distressing. I feel like the past 8 years have been the era of leggings. It's like everyone's wearing leggings all the time. And so groin sweating can be visible and uncomfortable and embarrassing. This device has not been used in that area just yet, but it is an area of study, and I can circle back to you and give you more information about that and what the landscape looks like going forward. For now, I do Botox or Dysport or Jeuveau injections in those areas with excellent outcomes. And And so it's not that you have no option, we just have a different option. And it's not a permanent option, but I can circle back and we can talk further. All right, and you can see it also doesn't take very long. Carly is already almost finished. This has been a pretty popular treatment even for our young patients, college age patients that have been struggling with sweating, or it's just an incredibly unwanted, much like unwanted hair. They really don't want to have to worry about sweating through their dresses or their clothes, or men through their dress shirts, or if they already wear an undershirt and their dress shirt. And knowing that there is a permanent alternative that is safe is really appealing. So, anyhow, if you have any more questions for us about this particular treatment, please send them our way. Even if it's not in real time, you can send us a message right through our website, and we will get those questions answered. We really are excited about all that we have to offer here at VLC. 4 years in, still having a great time with our patients and our community, and constantly adding more treatments to our repertoire and staying at the forefront of procedural dermatology is really makes my job a lot of fun. Of course, you guys, if you know me at all, I adore working with the incredible women that make DLC every day. So time to shift gears, go learn about the raffles. We have a very exciting raffle that Leanne will detail. So take it over, Leanne.
Thank you so much, Dr. Anigan. You know, it might be raining outside, but we're having a party in here. I have been waiting all day to say that. Can I just add? So, I may sound like a broken record at this point, but I do want to remind you about our specials quickly. If you purchase an event voucher, you are entered in to win the grand prize, which is Botox or Dysport for a year. That's 4 treatments of Botox or Dysport over the course of the next year. So if you purchase an event voucher, you are automatically entered to win that prize. Now, if you'd like to be entered in one of our other 5 amazing raffles, including the ISDIN and Galderma raffle that I'm going to feature here, you do need to purchase a product. All products are 20% off, and every product you purchase is 1 entry into these awesome raffles. Let's take a look. Okay. Jill, she put this adorable basket together. So you've got Aerofitona actinica, ultralight emulsion. This sunscreen actually has a DNA repair enzyme in it. So it helps restore sun damage from the past. It's lightweight, not greasy, great for men, great for golfers, really anyone who wants to reverse some of their sun damage from the past. I highly recommend this SPF. Now, also ISDIN brush, another great option for men. I know my husband really likes this brush. So this will come in the basket. And my favorite, which I took on vacation with me, are the Sun ISDIN capsules. Sun ISDIN contains a derivative of a fern from South America called Polypodium leucotomus. And Polypodium leucotomus actually increases your body's natural SPF. So it's great for people who have melasma because it helps you resist UV radiation damage. And so I really like these soft gel capsules. I'm actually taking them myself ever since I went on vacation because I want to increase my SPF and reduce my melasma. I mean, who doesn't want that? Everybody wants that. So the next item in this basket is Melatonik. And I'm going to demonstrate for you Melatonik here because we have a tester. And so as you can see, Melatonik is a gorgeous, delicious smelling serum. So it comes out of the dropper just like this. Just a couple drops on your skin will do at nighttime only. And the reason that this serum is a rock star is because it contains 2 antioxidants, topical melatonin and topical vitamin C. So you get the best of both worlds. It also contains topical bakuchiol, which is a retinoid-like compound that has retinoid-like activity, however, is not a retinoid. So it's great for people who have sensitive skin while still getting those same benefits of retinols. So 3 powerhouse ingredients, 2 of them are antioxidants, vitamin C, topical melatonin, and bakuchiol. Now, vitamin C has been around in skincare for a really long time, 40 years at least, and so we know that it has excellent data against fighting reactive oxygen species.
that comes from sun damage. Now, topical melatonin is actually super powerful. In fact, it's much more powerful than vitamin C. It's just newer in the stage. It's probably been around for the last 4 to 5 years, but the data is excellent. And so I'm so happy that we can offer this wonderful serum at DLC of Chapel Hill. And this bottle lasts a long time, gosh, at least 3 to 6 months. Okay, we have some questions. If we call to purchase an event voucher today, should we have our calendars ready to make appointments for upcoming treatments? And the answer is yes. That is a great question. Our schedule is still at a somewhat reduced capacity because of COVID-19. Safety is always our priority. So if you have a day in mind that you're like, yes, this would be a great treatment day for me to have my BBL or my skin pen or my Botox or filler, definitely be ready to make that appointment, especially if it involves numbing or if you want to use Pronox. If you do want to use Pronox for any of your treatments, be sure to tell our administrative team when you call or when you send us a Clara message so that we can schedule that for you. Now let's move on to some other ISDIN products. In the basket, you will also win the Podos Foot Gel. Okay, if you have scaly feet or just really want your feet to be nice at home in the winter, this is a product for you, okay? I swear it has transformed my husband's feet. They're soft and smooth. And I'm so thankful because he plays a lot of sports and his feet are usually, you know, athlete's foot. Also, Chaos Eye Cream, my husband's favorite eye cream because it's excellent for dark circles. If you have under eye bags, this is the eye cream for you. Let's demonstrate how we put it on. Okay, so you just pop off this top and you squirt like a tiny smidgen under your finger and you swipe it all the way out here and all the way out here. And so it's really great for under eye bags, and you can see it blends in really well. It's a nighttime and daytime product. Also with this raffle, you win a syringe of Restylane Refine, as well as 60 units of Dysport. That's a great treatment for Dysport for the forehead and glabella. And then Refine is a really soft, flexible filler that can be used in many areas. Now we're gonna head over to Dr. Adigan and our ALASTIN expert, Ryan. Thank you so much.
Yes, we're back. So now we're going to be talking about ALASTIN products, which thank you, Ryan. He's our ALASTIN expert. He's also going to join me in talking about the ALASTIN products. It's kind of hard to even know where to start because ALASTIN plays such an integral role in so much of what we do here at DLC. We are, a procedural-based cosmetic and medical dermatology practice, and so you can imagine the ALASTIN products play a role in just about, again, everything that we do. One of our favorite products is the ALASTIN Nectar. That is the pre and post-procedure workhorse. Do you want to say anything special about the Nectar, Brian?
Yes, and so Nectar was kind of our original hero product, and I kind of call it our gateway drug because everybody, normally is exposed to ALASTIN the first time through Nectar, and they fall in love with the way that it feels. But it does do amazing things to get skin ready for a procedure, to help clear out all of the damage that happens so you get the best result. And then it also helps the skin really to heal much more quickly. But you know my story, Dr. Adigan. For anybody that suffers from chronic sensitivity, Nectar might also be your best friend. It's been mine.
That's right, and that's a really good point. For some patients that really have a hard time tolerating most any product on their skin, I know that I can give them ALASTIN Nectar, and not only are they going to tolerate it well, they're going to enjoy it, and they're going to feel great about the way it makes their skin feel, and with the anti-aging properties, it's kind of hard to beat. A lot of times when we get someone going, they can start, if they're going to do a procedure, we get them going on the Nectar, they have the procedure, they have a great healing experience because they have the Nectar on board. We transition them to the restorative complex. The restorative complex has more anti-aging benefits, and so it's not appropriate for post-procedure skin. Do you want to talk about some of its characteristics?
Yeah, so restorative skin complex is amazing. It's sort of everything that we love about Nectar with our Trihex technology that's now protected by 4 patents, but it does some things that Nectar doesn't do. And specifically what I get the most excited about is what it does for a deeper, more meaningful skin plumping. So it's really amazing on its own, but it's also really great to maintain and prolong the results from your injectable treatments or from your procedures. And then it also has some hydrating properties as well as benefits that are addressing pigmentary concerns for skin brightening. So we kind of jokingly say it's our one and done product. If we had one we had to go to a deserted island with, that would be it.
That would be mine. It was sort of complex to be mine. There's a few other products I do want to touch on. I know that we're a little bit short on time, but they're really worth these few moments. And one of them is the Transform. You may hear a little bit more about Transform if you decide to do pool sculpting, but honestly, I do talk about it even with my non-pool sculpting patients. This is the only topical treatment that is shown to help with skin redundancy and crepiness. So crepiness is something that happens as part of the normal aging process, usually around the knees or on the upper arms. So if there's no more volume left, then it's the one topical treatment that will help with that skin crepiness and tightening that up. We also recommend it on the belly if you have some skin redundancy after babies, and you don't even have a whole lot of volume there left. We do it in concert with pool sculpting as well to optimize your outcome. We have phenomenal medical data to prove that it does work, which is kind of, I had to wrap my head around it. I was like, really? This can really work? And it really does. And so this is the Transform. Comes in a very big bottle. It lasts a long time because just one pump goes a very long way. And then two other products. I think we have some ALASTIN Hydrogen devotee patients with the sunscreen. Do you want to add any more to that?
It has a cult following. I mean, it's always fun to me. So it is a broad spectrum, all physical sunscreen that offers protection from infrared, HEV. It's a pretty potent anti-pollution complex. So antioxidants, and it feels really nice. This is one of those things that texturally I just think people love because it feels so good.
It's texturally unmatched, I would say, for sure. And then, of course, we carry the neck. This is probably my favorite neck treatment for unwanted pigmentation on the neck, and is the ALASTIN neck treatment. There's lots of different things that can happen to your neck as we age, and most of the things we don't really like, but it's tough because the neck skin is so sensitive, so we can't put Retin-A on the neck. We can't use a lot of brightening agents on the neck because it's too irritating, because the skin of the neck is so sensitive. But I think that's what makes the ALASTIN neck really unique, is that it does help with pigmentation, and you can put it on your neck. I mean, would you agree?
Yeah, absolutely. And you really hit the nail on the head. I mean, the skin south of the jaw is different than the skin on the face or the skin on the rest of the body. So it really is necessary to formulate for those physiological differences. And it's another one and done.
Yeah. Exactly. So thank you so much, Ryan, for lending your hand and your expertise and for supporting DLC all day today. And if you have any questions about the ALASTIN products, please send them in. They are a well-loved product line for good reason. They have rigorous data. They're very innovative, and they're really kind of an integral part of a lot of what we do. So we're going to shift gears now. We're moving over to the Halo room. So Halo is another treatment that I've never been able to live demo because, of course, it's a laser, but here we are at our virtual open house, and so we can actually demonstrate Halo. And I'm going to scoot myself over there too. And there's another added benefit. We're going to be doing Halo followed by platelet-rich plasma. And so we'll be able to talk all things PRP as well. Okay.
Hey, this is Carly. I'm in here with the Halo, and we're going to be treating Jenny this afternoon. Just getting started. Right now we're just mapping out her face. We have to do some measurements, and the Halo device will calculate it for us and decide how many spots or little injury zones that are going to be created based on the parameters that we put into the laser device here. So just getting started.
1 second, Carly. Just got to get my goggles. So yes,
Sorry, it's very loud.
Halo is really unique. Halo is the one laser that actually transmits 2 wavelengths in the same treatment. So there is what's called a fractionated ablative wavelength, which is known as an erbium laser, as well as fractionated non-ablative, which is the 1470 nanometers, which is different rejuvenative laser, but you get them all at the same time. And really what makes Halo so unique is that you get what's called ablative type results, which are more dramatic results but with non-ablative, which is milder, downtime. So the recovery period is very predictable with Halo. And I will eventually get my goggles on. Sorry, Carly. There we go. All right, I got them on, Carly. And I'll go ahead and sit down so that I don't have to keep on bending over. All right, so, got my seat, sitting down. We're going to talk all things Halo. So you can hear the Halo. Has a little bit of a snapping sound. And you can actually see exactly the area that's been treated. And what really, Halo is one of, really kind of changed the landscape in so much in the fractionated laser area by combining those two unique wavelengths at the same time. There's other fractionated technology available, but the Halo has really been the most predictable and effective lasers that I've ever had the opportunity to use. So it is really one of the workhorses here at DLC. We use it for its rejuvenative properties, of course, but it also actually improves the overall health of the skin. If you have a lot of sun damage, it doesn't just make your skin look better, but it actually treats precancerous change. And with medical studies to support that, as well as settings to guide us to make sure that we are giving your skin the best boost that we can possibly do. Sometimes patients will ask, well, will it treat my wrinkles, and my brown spots? And the answer is yes, it can do all of those things, but maybe not in one treatment, because we can only do one depth during any one treatment in any one area. We may vary the depth from one area of the face to another area of the face, but I can't do two depths on one area of the face. And so, and sometimes we have to do more than one treatment to address more than one issue, but no matter what, everyone loves their skin after a Halo. It's really remarkable. We can use it in all skin types safely. It's just all about having a person that knows how to use the device and knows how to adjust the settings appropriately to address your particular concern, your skin type, and what kind of outcome that you're looking for. And so to prepare for a Halo, we typically apply topical numb gel. And you leave it on for about 45 minutes or so, and then we'll clean it off, and then we do your Halo. Sometimes, I would say actually frequently, or even most of the time, we will combine a Halo with the BBL. We do the BBL first, and then the Halo second. There's something about the combination of those two treatments that really are synergistic and give phenomenal results. You can see many of them on our website if you're interested. And that allows us to treat the superficial pigment with the BBL and then go deeper and get more rejuvenative benefit with the Halo. So here's a question. What does the Halo feel like during the procedure and after the procedure? Great question. During the procedure, again, you will be numbed up. And if you also would like Pronox, that's always available. But I would say, there's plenty of people that don't do it with Pronox, but if you A, don't want to numb as long, or B, don't want to feel anything, which is also fine too, then Pronox plus numb gel is a great combo for Halo. But it feels like a prickly sensation as you're having it done, and you can kind of hear it, the little prickle, 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 prickle. You hear that little prickle, prickle, prickle? That's really what you're kind of feeling on the face. Once Carly, or who's ever doing your Halo, whether it be me, Carly, or Leanne, moves to a new area of the face, the area that's been treated will feel very hot. Part of why Halo works is because it is able to deliver energy into the skin incredibly effectively. The way a fractionated laser works is that it makes these microscopic columns of essentially vaporized tissue to the depth that we decide with intervening unaffected skin. So that's why it's called fractionated rather than fully ablative. And what that does is stimulates the skin deep into the skin, depending on how deep we go, to have this rejuvenative benefit without you being totally wounded, again, because you have these islands of unaffected skin in between where the fractionated laser is treated. So recovery from Halo is, again, it's predictable. So everyone is recovered in 7 days, but not everyone's 7 days looks exactly the same. Depending on how aggressive your treatment is, depending on what you want to get out of any one treatment, you may have more redness and more swelling than someone else. For our younger patients that are really more many pre-rejuvenation patients that are really trying to maintain, they want their skin to look as young as possible. Doing Halo younger can help your skin look better over time. But you don't need an aggressive halo. I'm not trying to get to the bottom of every one of your wrinkles. Okay, and so you may have some redness and maybe some swelling that lasts maybe a day or maybe 2 days, and then a little bit of your skin feels about like sandpaper for several more days, and you're all done at week 7 or day 7, excuse me. But for someone that really wants the most rejuvenative treatment possible, then we're going to really push the settings quite a bit more. Then they're going to have more swelling and more redness for maybe 3 or 4 days, and then feel sandpapery for a couple of days. Again, they're done at day 7. One of our favorite ways to prepare for a halo is using the ALASTIN nectar for about a week or 2 weeks before your halo. That will prep your skin so you get the most out of your treatment, and then you're going to really love the nectar during your post-care, because your skin will feel like it has a bad sunburn. That's essentially, it will feel sensitive, it will feel hot, and then all of the immediate heat will cool down. A hot shower does not feel good the first couple of days, and your skin can be a little bit tender. And so having a product that you can put on that just glides on, so that it also helps your sunscreen glide right on top of that, is really quite nice. Which brings me to the next thing, is that you're not wounded after this. We'll end up after the halo, we put on the nectar and sunscreen, and you're on your way. So that's another, it's a phenomenal procedure that brings such dramatic results with really no significant recovery period. A cousin to Halo is another lace that we have that I'm not actually doing a demo of today, which is the TRL, which is what we call a fully ablative laser. That's going to take the whole top layer off of whatever I can decide exactly how deep I want to go, which is really especially for like overall skin brightening when we do a nano peel, maybe a little bit more aggressive for more extensive sun damage with the micro peel, or for the really deep lines around the mouth or around the eyes when I go a bit deeper. So that's a different laser, but it comes into the halo. What we're going to do today is once we finish treating her full face, we're actually going to apply her own plasma to her face. So now she has all these tiny little channels all over her face that were created by the halo, and we're going to be putting the PRP directly on top. And then those growth factors are going to go right into those channels to really basically take up the rejuvenation procedure up a notch. I have another question. Can you wear makeup while you are healing? And the answer is sort of. So for the first couple of days, we want you to be wearing sunscreen every day. And ideally, you could use a tinted sunscreen that can double as your makeup until we're really sure that you're no longer kind of swollen or tender, which usually is just a couple of days. Then you'll be able to transition to kind of regular makeup. But tinted sunscreen right away. Absolutely. And so back to the PRP. So PRP, what is PRP? PRP is platelet-rich plasma. And there's actually, PRP was first developed in the orthopedic literature, and it's used commonly in orthopedics to inject into joints to stimulate bone and soft tissue regeneration in the joints. We use it in dermatology to regenerate skin and grow hair. And could you please pass me a glove? I'm actually going to show you getting PRP right now. So right before this, we drew her blood and we put it in a special type of tube and centrifuge, and then separated out her PRP. And we call it liquid gold. And so the PRP is really more or less the most magical liquid, and of course it comes from our own body. What's really kind of neat is that there's not been a single adverse event reported with PRP, because it is yourself. You're putting yourself back either into yourself or onto yourself, so not a single allergic reaction. Okay, I just want to show you the liquid gold. Here it is. That's PRP. If you were to have PRP with your microneedling or PRP with your halo, what we would do is when you come in for your pictures and for your numbing, we would draw your blood right then, because it takes about 30 minutes to spin. And again, I do PRP injections for growing hair as well. It's used for all different types of hair loss. It has, again, all these phenomenal properties, anti-inflammatory properties. You're going to be very hot after a halo. Once you put the PRP, it takes down the inflammation almost immediately. It's really incredible. Is there another question? I want to make sure I didn't miss anything. Oh, here it is. How long will it take to see full results in the halo? That's a great question, because you actually are going to feel amazing about your skin about a week or two after your halo. You're going to feel like your skin looks so good. But honestly, about 3 months after your halo, you're going to look at yourself and you won't even believe that it's your skin, because it takes time for that collagen to build and to remodel. And right at the 3-month point, it's like, how does my skin look so good? But you get that more or less immediate glow. We call it the halo glow within about a week or two of your first treatment. It's really fast. But again, it continues to get better and better. I tell patients, I'm like, you're gonna love your skin, but you're gonna really love your skin. In another 6 to 8 weeks, you're gonna really love it. We usually have people come back after their halo about 4 to 6 weeks to take sooner, so that you get a chance to see your own pictures. It's really like the most fun part of my job, and one of the most fun things that we do here. All right, so now we're gonna go see Leanne in the lobby again, so that we can review our specials and do some question and answer, and I'm going to join her there too. Hi, Leanne.
Wonderful. Hey, Dr. A. So I just want to thank everyone so much for tuning in with us to celebrate our 4th birthday. Dermatology and Laser Center has grown, and we are so thankful to all the community for your support. It is our pleasure to serve you. And I am going to put my mask back on because I know Dr. Adigan is coming up. But as a reminder, you can purchase an event voucher today and tomorrow. That event voucher is $250 and goes towards your treatments that you can use up until November 13th. So you get 20% off all single treatments, Botox, Dysport, chemical peels, Halo, and you get 10% off all treatment packages like Skin Pen, BBL, and microneedling. In addition, we're having 20% off products, and 20% off products, every product that you purchase is one, go over here, is one entry into one of our 5 incredible raffles that we've demonstrated throughout the day. All of the raffles have over $1,000 in value, and they all come with some kind of treatment as well as product. So I want you to win. So get stock up on your sunscreen, or if you're doing a laser or microneedling, definitely the nectar.
Oh yeah. I mean, there's usually something that can go with just about any procedure here, and really that will meet most people's interests. And honestly, if you have a question, you can ask us, and we can help guide you decide what might be the best choice for you.
I think that's a great point, Dr. Adigan. You have to offer a variety because there's no one perfect brand or solution for everyone. And so that's why we really stand by all the things that we carry. It's not just one line.
Yeah.
We have a variety of different things to suit different needs.
That's right. And that's the thing about skin. Like, no one person's skin is the same or has the same needs as someone else. And again, we take great pride here at DLC being able to take care of all types of skin, all colors of skin, all levels of pigment in skin, all ages of skin. We do take care of all of it, but that also means that there's going to be a lot to choose from because the needs can vary so much. We have a question, it looks like.
It's a compliment. The virtual birthday party has been awesome. Thank you so much. We really appreciate your feedback. And again, you can get the 20% off, like someone is mentioning, products today and tomorrow, and the vouchers are available for purchase until tomorrow, so don't miss out.
That's right. And so thank you so much if you've taken any time to join us today. Also keep in mind, if you have missed any of the videos and you're interested in seeing the videos, all of them have been recorded and all of them will be posted to our website and our social media. I guess that means onto our Facebook and
Instagram.
So on our Instagram as well as our website. So please don't fret if you're like, oh, I didn't get a chance to see something that I wanted to see. Know that all of it's been recorded.
Okay, it looks like we did get a last minute question.
Okay.
So let's answer Katie's question.
Okay.
I have really sensitive skin, like really sensitive in all caps. What's the best sunscreen for me, Dr. Adigan?
Well, sunscreen brush. I know,
for real.
So some people really do have phenomenally sensitive skin, And if you have really tried a lot of different things and you're still hitting roadblocks, the brush has no liquid vehicle, and by bypassing that liquid vehicle, which almost always has the component that's irritating, if you go to the brush, there's no liquid vehicle, and you'll be protected, and it's really can be great for unbelievably sensitive skin.
What a great explanation, Dr. Adigan. Everyone, thank you so much for joining us.
Yay.
It's been a pleasure.
Thank you.
Thank you.
Yay.
Bye. Happy birthday, DLC.
Happy birthday, DLC.
Achoo!